days, you infect 0.625. In 30 days, 2.5 persons. Remember, the virus does not move on its own. People move it. The more space between you and others, the harder it is for the virus to spread. A health and wellness message from your Ministry of Health. If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be used to self-quarantine and limit contact with healthy persons. Keep away from older persons and persons who have medical conditions that affects their immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800-664-2273 for guidance. A health and wellness message from your Ministry of Health.
If you have a cough or a sneeze, cover up to the right thing, please. Boys and girls, the entire family, help protect the weak country. Wash your hands properly. Wash your hands regularly. Soap and water is all you need to scrub and rub naturally. Coronavirus, seriously, it took over the world practically. Stealing lives with no remedy. You pay everybody fee up cautiously. Boys and girls, the entire family, help protect the weak country. Wash your hands properly. Wash your hands regularly. Soap and water is all you need to scrub and rub naturally.
In response to COVID-19, the government of Belize has implemented strict guidelines on persons to practice social distancing to reduce the spread and risk of getting COVID-19. Practicing social distancing is when one maintains a greater than usual distance away from another person. In public health, it is a practice to prevent sick persons from coming in close contact with healthy people. Recent studies are showing that social distance of 3 feet or more decreases the exposure of COVID-19. Before these restrictions, a person with COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce the exposure activities by half of that one infected person, in 5 days you would possibly only infect 1.25. 30 days, 15 persons. Reduce the exposure of that infected person by 75%. In 5 days, you infect 0.625. In 30 days, 2.5 persons. Remember, the virus does not move on its own. People move it. The more space between you and others, the harder it is for the virus to spread. A health and wellness message from your Ministry of Health. If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be used to self-quarantine and limit contact with healthy persons. Keep away from older persons and persons who have medical conditions that affects their immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800-664-2273 for guidance. A health and wellness message from your Ministry of Health.
If you have a cough or a sneeze, cover up to the right thing, please. Boys and girls, the entire family, help protect the weak country. Wash your hands properly. Wash your hands regularly. Soap and water is all you need to scrub and rub naturally. Coronavirus, seriously, it took over the world practically. Stealing lives with no remedy. You beg everybody see cautiously. Boys and girls, the entire family, help protect the weak country. Wash your hands properly. Wash your hands regularly. Soap and water is all you need to scrub and rub naturally.
Good. Good afternoon, everyone. We were here last week to discuss where we were with our testing, so I'll be providing a brief update in terms of the numbers. I'm just coming out of an oversight committee meeting, which is still ongoing. And this afternoon, also Mr. Esner Vellos, who is the head of the National Drug Abuse Control Council, is joining me because on Sunday, May 31st, is World No Tobacco Day, and there is an established link between people who are heavy smokers and COVID-19, and also smoking leading to chronic obstructive pulmonary disease, COPD, and the risk that implies for COVID-19 and the complications. So in terms of our numbers where we are, and this is part of also my notes that I gave to a meeting earlier today, we did 31 further tests yesterday, Tuesday. We have, as you would know, been doing testing on Tuesdays, Thursdays, and Saturdays. From the last time we did 51 on Saturday and 31 further yesterday, all of them are negative. And so what we did is, in discussions with CARFA and what's happening in the Central American region, we will note that there is not random testing being done in asymptomatic population. So we are taking it a little bit further in Belize, and that's why I wanted to bring, I have some figures here in terms of what our testing rates are, because when people look at 1,517, I think is the total number of tests, people are going to be saying that that's not enough. But when you look at rates, then I did the comparison with the countries that are having epidemics and who are in the region. Belize has a testing rate of 3.8 per million, which is interestingly twice what Mexico is reporting, which is at 1.8. That's rate per million. Honduras is at 1.5. Guatemala is 1.8, and we are in a similar, almost similar trend to Costa Rica at 4.7. Brazil, which has as you would note, a raging epidemic now, and significant increase in numbers that they could very well be the next ground zero. They are reporting a rate of 4,104 or 4.1 per million. Argentina is at 3.1. So when you do rates in the region, you will note that all our immediate neighbors, when you compare Guatemala, Honduras, and Mexico, we are doubling the testing rate per million, or even if you want to do per 100,000, per 10,000, the rates are double what these countries are reporting. Nicaragua doesn't have a report in terms of how many tests they have done, and you will notice they are increasing numbers over the last couple of days. From the last week to now, I think they are above 300 now. Now, in terms of data from the region, because even though we are now entering the 7th week since we last documented a case. We are counting those days, of course. We cannot lose sight of the fact of what's happening in the region and around us. The US, for example, now in the last 24 hours, this is data from the last 24 hours, the US reported 5,480 cases. Mexico reported 3,455 new cases. Honduras, with an increasing epidemic, 212. Guatemala, 194. El Salvador, 67. And Jamaica had 8 new cases in the last 24 hours. These are the countries closer to us. In terms of death rate, because that's also a statistic that we keep seeing people saying, well, you had 2 people die out of 18, your mortality rate is 11.1%. That's doing raw math. But when you also do death rate per million, Belize's rate is 5 per million inhabitants, but the US has a 305 rate, Mexico has 63, Honduras has 19. The only other countries that are similar to us would be Guatemala, El Salvador, and Jamaica. They're all at 4, 6, and 3, respectively. One other note in terms of total numbers is the amount of people that are also dying and reported over the last 24 hours. Mexico yesterday reported for the first the amount more than 500 people dying in one single day. 501 people were reported to have died in Mexico over the last 24 hours. In the US, that number is at 256 in the last 24 hours. Honduras reported 6 deaths associated to COVID-19. El Salvador 1 and Guatemala at 4. So you will notice that there's a PAHO report by the Director General that talks about the increasing numbers that they are anticipating for the Central American countries, except Costa Rica, that their numbers don't seem to be going up. And of course, we have not had a case in the last 6 weeks and counting, going to week number 7 now. So that's what we have in terms of total numbers. Given what Central America and the Caribbean are reporting, we are anticipating that starting next week, we are going to be doing testing only 2 days per week. It's either going to be Monday, Thursday, or Tuesday, Friday, unless you have a case that has a significant risk or high suspect of having COVID-19, that sample will be processed. One other final note is all those persons who are under quarantine at the different areas, whether they were caught entering the country illegally or the 20 people that have come through a planned repatriation process, those are all going to be routinely screened. The last number, as you would note, is the 10 people that came from the ship on Saturday. All preparations were made for them, and they will be screened before they are let go from the quarantine facility. As more people start to be let go from the ship's Belizeans, of course, we will be reviewing those cases individually, because in some instances, some of the people in the cruise ships have been there for 6, 8, 10 weeks, 72 days, I think is a report we got. Not because they have been having cruise business, but because they are all employees were put in one ship and they are being taken to their countries of origin. Some cruise line had anticipated that they would be able to give us a test before they depart the ship as a part of their health status report, so that if that is okay with us and we are able to screen you upon arrival, your quarantine period may not be 14 days, but that's going to be done on an individual basis, and that only applies for people in cruise ships. And one final note before I ask Esner to give us his notes is in terms of the people who are seeking repatriation. Understand that it's a process, because the amount of calls that are coming to us are primarily around this topic now, that has to be reviewed by Immigration Department, Ministry of Foreign Affairs, and the Ministry of Health. So everybody who is going to be asked to come or be allowed to come has to be agreed by all 3 entities and signed off by the Attorney General. That's a process for everybody. And everybody will have to go into a mandatory quarantine facility, which is usually going to be a hotel as designated, depending on where your entry point is. We are aware that some people filled the application form and started their journey back home, people who are very far away, and that's not supposed to happen. You need to fill in the form and await for further guidance before you can show up at the border, because as you would know, the borders are not open, and we're trying to have an adequate process to safeguard your health and the health of those who are here in Belize. So if you can bear with us as we are working through that process of gradually allowing Belizeans to come back. I think it's close to 500 people that are now enlisted, and we have all kinds of persons in that list: students, people who are on duty travel, on training, people who had to leave because of a funeral or family emergency. A surprising amount of people also, tourists, or people who were working in other countries and just quit their jobs and are coming back home. But that is a process. Bear with us as we work it out, so that we are able to do it in a planned fashion as we move along. So I'll ask Esner to give us a presentation in terms of where we are with COVID-19 and the work that your desk does. Esner heads one of the 19 different units that are within the Ministry of Health. So, Esner.
Thank you very much, Vak, and a pleasant good evening to the entire country of Belize and all those who are listening or viewing us via the internet. Indeed, the National Drug Abuse Control Council of Belize and the Ministry of Health joins the entire world this coming May 31st to celebrate and commemorate another World No Tobacco Day. Every year, the World Health Organization celebrates this remarkable moment whereby a number of countries had signed the Framework Convention on Tobacco Control to look at safeguarding the people who are exposed or consumed tobacco in the different countries and different regions. This year in particular, the World Health Organization is celebrating the day with the theme Protecting Youth from Industry, Manipulation and Preventing them from tobacco and nicotine use. As we all may be aware, the tobacco industry is a multi-billion-dollar industry that, based on the resources that they have, they use these resources to be able to attract young people in various different ways, in terms of their marketing strategies, in terms of their product handling, in terms of making sure that there is accessibility of these products to young people, as well as supporting other ventures such as sports, such as culture activities, education, and so forth. And that is the reason why we here at the National Drug Abuse Control Council are concerned specifically, because our young people are those that are more exposed, not only in terms of the consumption of tobacco, but also in terms of the consumption of more modern type of products such as electronic cigars, hookahs, chewable tobaccos, and all of these contribute to the deterioration of the health of our young population, and as well as the deterioration of the health of the wider population, including our adults. Recent surveys that were done here in the country through the Global Youth Tobacco Survey indicates that approximately 45% of our young population are consumers of tobacco products. Hence the reason why the National Drug Abuse Control Council and the Ministry of Health emphasizes the whole idea of providing the tools and the messages that are necessary so that our young people will be deterred from the consumption of tobacco. So one of the things that this team for this year wants to do is debunk the whole idea of what is being put out there by the tobacco industry. For instance, the tobacco companies produce their products and they make it more friendly to our young people, meaning that they would produce them and package them in forms of sweets, in forms of USBs, and things that are more attractive to our young people. Hence the reason why it is very important to make sure that our young people are aware that these are ways in which they are trapped in one way or the other to the consumption of tobacco. We're also looking at making sure that the accessibility of the products of tobacco and other products associated with tobacco are also in one way or the other used in so that there's that accessibility for our young people. Hence the reason why the National Drug Abuse Control Council is pushing towards legislation that would look at making sure that young people are not exposed to tobacco consumption. They are not exposed to the sale of tobacco, but more importantly, are not exposed to the accessibility of these products. The National Drug Abuse Control Council has been planning, and every year we plan activities to make sure that we can emphasize the message to our general population. This year was that exception. We started planning World No Tobacco Days activities, whereby in the month of May we solely dedicate the work at the National Drug Abuse Control Council to addressing the issue of tobacco product and tobacco consumption. This year, we had started our planning since January. Unfortunately, we are not able to do that massive public gathering activities that we are used to doing at a national level and also at a local level. However, we are bound to making sure that the information that is needed to be known by the general population is set forth so that they will be able to make the right choices in life. Especially right now that tobacco consumption has a big connection in terms of COVID-19 and the effect that it has to individuals who are COVID-19 positive, in terms of the individuals who have consumed tobacco for a long period of time in their lives are more susceptible to have COVID-19 infect them more vigorously and more dangerously, right? So that is one of the things that we are looking at and making sure that as a ministry, we are providing the information to the general public to making sure that our young people will be able to reduce the consumption of tobacco and at the same time reducing the exposure to secondhand smoking in the country of Belize.
Yeah. Okay. Thank you, Esner. Yeah, because I do note that people might be concerned what is the actual link. As a clinician, I will tell you there is more than evident link, and not just with COVID-19. Anybody who's a heavy smoker and has any flu or bacterial infection, your prognosis can be significantly compromised simply because of the previous lung damage that you may actually have. So we'll go to, I think they're starting to come up with questions for us to answer. So I'll go through them rather quickly. I think how many people are currently under quarantine and where? The last note I got was 57, and we had people in Corozal, Oranjewak. In Oranjewak, you included people at Lamanay Landing, which is a hotel that has people under quarantine. Belize City, of course, the people that came in on Saturday. PG, San Ignacio. From San Ignacio, had people who were caught, Guatemalans caught illegal entry into Belize through this long weekend. So those are being kept in quarantine facilities. It's a total of 57. 20 of those are Belizeans who came into the routine process of repatriation. And out of the remaining 37, not all are Belizeans. You have some people from Honduras, Guatemala, and Mexicans who have been caught illegally coming across the border. What if a Belizean that is coming back home through the repatriation process is found to have the COVID-19 virus? Well, we are not routinely screening you upon arrival. I must say that in terms of the repatriation process, we are going to screen you prior to you being left out of the quarantine facility. If you are positive, then that's when your day one actually begins, and you will be more than likely there for at least 14 days, on average 21, hoping it's not going to be much more extended than that. So we start counting if you turn out positive the day you turn out positive. Will that count towards our total number? Yeah, that will count towards our total number. And that is not going to count or imply that we have active cases if you're able to control it. And you can use the example of what happened in Corozal with the person who was caught upon entry, diagnosis made, and that person was kept in the hotel room for 2 weeks. And that's the intention of having a process such as what we intend to do with the repatriation, which is planned, programmed in a more controlled kind of environment, so it gives you a better grasp, so that people would not have had interaction with anybody and potentially infect others. Understand that once you come to a quarantine facility, the Radisson is where they are being kept in Belize City. People are not going to be going to the restaurant to eat. People are not going to be going to the pool. You are basically confined to your room, because what you want to minimize is interaction with others. That's the reason why you're being kept there. So I think it's important that we stress that, and anybody who's coming back through that repatriation process will have to go through that same mechanism, regardless of where you're coming from, because it could also be that through the airport you become infected, or it could also be that if you're coming by land border, especially northern, now the western border, those can be situations that can make it a little bit difficult for us to handle. How many people were supposed to come on the Rhapsody of the Seas? We heard it was 14. If so, what happened? Actually, no. 14 was actually from a different cruise ship, and there was a set amount due to come in on Friday, 14, and another set to come in on Saturday. So the Rhapsody of the Seas was not even one of those two that we had on the list. We only were made aware, as a ministry felt at least, on Friday evening, that it was Rhapsody of the Seas, and that it was 11 Belizeans who were coming and going to be let off from the ship on Saturday morning. 10 Belizeans eventually came off. We understand that the 11th Belizean remained on the ship because he continues to work on the ship, and that's the reason why he didn't come off. That's what the report that we got. But we're aware of the 10, and we have Central Health Region is keeping track of those 10 persons. It's not surprising that there are those who would still not follow the procedures. What will happen to those people who arrive here before the applications are approved? Well, some I think are stuck in Cancun or in Chetumal, because we haven't gone through that process. I know there's somebody that specifically is coming from the African continent, and by the time we were alerted, the person was already in Cancun. But again, we're trying to expedite the process to make sure that it's a proper flow on it. Everybody is aligned, because it's not only the Ministry of Health now that needs to be involved. I already mentioned the other ministries that will go through that process of ensuring that the due process is followed. Summer months are usually a time Belizeans travel. What are the recommendations for the Ministry of Health for traveling over the summer? I would assume it's people leaving Belize to go abroad. That's a very difficult situation. Off the bat, I don't know where people would go. I don't know that's a routine recommendation I would want to give anybody. We don't know when the US is going to peak, so you're basically exposing yourself. I don't know how much of exposure to wherever you're going, or if you're going on vacation, if you're going to be going to vacation spots, how much at risk you are going to potentially be. Once you come back, you are more, remember, if you ask me right now, once you come back, you will have to go through that same process of asking for a repatriation until the border is officially open, which means you will have to enlist yourself, and you will be given a specific time and date when you're able to come back. And even if the airport is open, if you're returning Belizean, that's part of the discussion. You may have to go into a mandatory quarantine at your own expense for 14 days, because we are not able to ascertain how free you're going to be of COVID-19. And again, this part becomes part of the new norm that I suppose most people do not necessarily want to hear. Are more hotels enlisting to become public quarantine stations? Yes, I think they're from across the country, not only Belize and Corozal. I know there's things from Orange Walk, the islands, and the Cayo district as well. And at reduced rates, they're negotiating with the government and the potential persons that are going to be coming back, because it benefits them as well. Can you talk about the group of Asians from Nert and Toledo and their crew detained in the south while fishing? Where have they been placed under quarantine? Other than they did not pose a health risk, I don't know if I'm able to comment on what other measures other ministries may have found with them. From the health standpoint, these are Belizeans caught in Belizean waters fishing, so that would not necessarily pose a health risk from our end. They were not placed at the quarantine station in Toledo. I did check late last night, 9 o'clock. And they had not, there's only 4 people that were there, and they were not, those persons that you are referring to were not in that quarantine station. Why weren't Belizeans allowed to come in on the US flight on Friday? Not having the entire details as to what happened, but I do know that the full process of getting all our I's dotted and our T's crossed, if you will, amongst all the ministries had not been completed. So that is part of the process as we're going along. Understand also that this is, as far as I know, this is not really an open flight where you could have booked in, as my understanding at least, this is a flight that was already paid for to come and pick up people, and I assume that that's going to be the case as we move along with other flights that are coming out to pick U.S. nationals. This is not, that's another perhaps clarification, because my understanding from somebody who asked us earlier from El Salvador is the assumption is that the government is sending flights to pick up Belizeans to bring them back from the U.S., from El Salvador, and wherever they are. That's, I don't think, has ever been part of the discussion. This is people who are able to come, how we get you into Belize and ensure that you are safe and are potentially not exposing others. That's where the concern is in this whole matter of repatriation. What if I have the virus and recovered? Will I still be quarantined if coming to Belize? Well, you will have to prove that to us, that you have been exposed and that you have developed immunity. And I believe we will have to look at your case on an individual basis. That issue of that has given rise to what is called an immunity passport needs to be cross-checked. It's not something we are routinely, as public health, recommending. I think we have to look at it on a case-by-case basis. That's not only for Belizeans. Whoever is coming to Belize with that particular situation. Can a Belizean with COVID be legally prevented from entering the country? Well, I did not study law, and I don't intend to study law, so I don't know what the legal process is in that regard. I can tell you from the health standpoint, what we would do is we have an obligation from the health standpoint to safeguard your health. So if you show up, again, I'm trying to picture how this would happen. If you're showing up, I assume with symptoms, the only way I will know is if I test you. And we have said that once we do that, then we take the necessary precautions. If you can be quarantined and isolated in a particular entry point, then that's how it's going to happen. If we need to move you to a quarantine facility, then we will move you to a quarantine facility. And that has happened already. Remember, one of the patients who was in Corozal for his 2 weeks waiting out until he recovered from COVID-19. Would you speak about the courtesy being shown to diplomats who are entering the country and allowed to quarantine at home? Again, this is not I don't have a legal background, nor do I intend to, but I'm trying to remember the name of the protocol. There's a specific, the Vienna Protocol. I might be wrong, but I think that's the name that speaks to specific people who are holders of diplomatic passports and how they are allowed to travel in and out. What I can tell you is that this has happened from February, before the borders closed. We had diplomats coming in who followed the routine public health procedures. People would be checked up at home. And again, this is not a vast amount of people. I know that's what has happened with a couple of diplomats from Guatemala who are allowed to go, and they need to be checked upon arrival. They need to be quarantine facilities checked at home, and then they can be checked based on public health laws if that is what is warranted. But that's, again, that's not my legal take on it, but that's my understanding as far as I have been able to ascertain in health. Would you speak about the deployment of the Cuban Brigade? Are they being underutilized? That's the second time I've been asked that question today. They are deployed across the country. Half of them stayed at Carlushna. The other half went to different facilities across the country. I know one of the Cuban doctors is the one manning the flu clinic in Independence. I don't know that they are being underutilized. I also said that earlier when I was asked. I said once we have human resources for health trust me, they will be utilized, because you will know that we are understaffed in certain elements of our health system. So they are being utilized, not necessarily for COVID-19, but they are being used in the health system for sure. When will the gyms be able to open? I am not going to preclude what has been just discussed and the advice we have given, but you should have, I think, further answers before the end of the week. When the airport reopens and Belizeans that were not displaced start coming back home, will they have to go into quarantine? That's again, this is a situation we are reviewing, again, coming back from the oversight committee, because we're still trying to find a smooth flow of how people arriving at the airport would go through. And that's the same question all CARICOM, English-speaking CARICOM countries are having. We're having a further virtual meeting on Friday, because I don't think we know what the straight answer is, if there is any straight answer. So it's an evolving situation. We are following closely what two countries are in the region are going to be doing. I believe St. Lucia and Antigua are two countries set to open up their airports. So we'll look at how that flow goes for them and see how that can be implemented, if anything can be implemented for our local context. What do you say about the Italian doctors that after the postmortem they find out that COVID-19 are dying from blood clots? Is that true? Yeah, it has been reported in the literature that people who had COVID-19 have a higher risk of thrombosis and thrombotic events. In one of the previous sessions we had, I did indicate that at least 2 of the patients that I am aware of in Belize were treated for prothrombotic events. So assuming that they could have had pulmonary embolism, which is the correct medical terminology, they were given anticoagulants. So that has been used in Belize. Again, with COVID-19, you're finding lots of things as you move along. And understand that COVID-19 is a virus, but you can actually die from sepsis, which is an overall infection of your system, complications of maybe you're going to kidney failure, if you are maybe you are diabetic and had previous kidney disease. There's many other conditions that COVID-19 can trigger. We have said diabetics, hypertensive people, obesity is a factor. For example, people who are being found with clots in their lungs, the fact that you're obese puts you at a higher risk, because you are in a more prone to developing clots in your system just because you're obese. I think that's important that we say that. The CDC has said that the flu is more lethal than COVID for children. Why the hesitancy and resistance to opening schools? More lethal than COVID for children. That's again, it's an evolving situation. COVID-19, if you notice in children, is children are dying of not necessarily COVID but other complications of that. That discussion in terms of resistance to opening schools, I don't know if it's a resistance. I think it's a preparation phase that our schools will have to go through. It is a new norm, and so all schools will have to be prepared for that. It's not a question of just opening up right now, but even if we open up as we move along, we will have to take the necessary precautions to ensure that schools are adequately prepared for when they open up. Can you discuss the case of the doctor at Southern Regional Hospital who was opposed to be transferred to Hopkins? Transferred is not the word when you look at the public service regulations. He was going to be posted in Hopkins for a certain period, and that's simply because it's in the same catchment area, if you will. So that's a decision that the region can make on their own. Just like if you're working in Belmopan and you're posted in San Ignacio, or if you're stationed in San Ignacio and are posted in the San Antonio Health Center in San Antonio Village, Cayo, or in Benque at the Mopan Clinic, or at the Santa Elena Health Center, those postings can happen. I don't know if the doctor was actually completed that posting, but I can follow up what happened with him. The BMDA characterized this as a punitive measure since he had spoken up about lack of availability of PPEs. I was never made aware that this doctor spoke about lack of availability of PPEs. And I have had discussions with the chair of the BMDA to express not the reason why he was being posted, but to explain what a posting meant and other issues around this particular case. But in my view, that has been cleared up with the Belize Medical and Dental Association. And the doctor has I have an open door policy. If he also feels that he's being aggressed because of that, I think he can come and address that situation. Well, it says he's still at Southern Health Region, has not been posted. I will have to find out what's happening there. Is it true that COVID-19 is not a virus but a bacteria? COVID-19 is the actual name of the disease. It is caused by a virus. The virus is a SARS-CoV-2. That's the full name, and it is a coronavirus. It is not a bacteria. Do we have the rapid test kits as yet? No, none approved. I just got another question earlier today with the full details of another rapid test that they want to start bringing to Belize, but not approved, has not gone through the process. Would it be an option that when the borders reopen, everyone coming in Belize would be swabbed with a rapid test in the country of departure before allowing them board the flight to Belize? That's part of the discussion that we have had. That's not a decision that only the country of Belize can take, though. That has to be done in tandem with airport authorities and the airlines, because it is the airline that will determine whether you're able to board the plane or not. That is part of the discussion, and I think that's going to be looked at as we move along. And having an agreement to do likewise before boarding someone to depart Belize to our next country, that is an option. However, I don't think it is going to be a rapid test. I don't think we will be getting any viable, high sensitivity, high specificity rapid test in the next couple of weeks or even months, because the date seems to be prolonged for when that will happen. And I threw out another question earlier today. Let's say if you start doing it upon arrival as well, what happens if you find out somebody is positive in a rapid test and you have a full flight of 180 people? Do you have the 180 people just wait out of the airport until you have determined whether that person is in point of fact truly positive? I think that's part of the concern that we have. Please explain the difference between virus and bacteria so persons can understand. That I have to go back to my basic biology teacher, who is a lecturer at UB now. Well, a virus is again, that if you get into the basic biology, a virus is not a living entity in and of itself. And I think if you go back to basic biology, a virus will need a cell in order for it to be viable. And when I was in HIV, I always used to say that I can have a bunch of HIV viruses sitting on the palm of my hand. It doesn't really do anything. It's whenever it invades a host cell. This is the same thing that becomes applicable with COVID-19. It's a virus. It's not per se, it doesn't have the full genetic material for it to be a living entity. It requires living cells in humans or in any species that's living in order for it to be able to thrive and do all the damage that it routinely does. Can you speak about cargo movement which continues, and if any safety protocols are in place to avoid possible contagion? At the north, that's been pretty much set out. I was there last week and I could see the flow of traffic in terms of trucks coming to the northern border entry point and into the cargo area. It's only Belizean trucks coming into the cargo area. I think it's a very smooth flow. I can tell you that's a heavy topic of discussion in Central America. There was a lengthy discussion on Monday afternoon with ministers of trade and economy, because I believe it's Nicaragua that has close to 1,680 trucks stalled because they can't move because of the processes and procedures that each country is trying to establish to ensure that you have a smoother flow without possibly exposing others to the virus. With the Guatemalan border, that's a work in progress in terms of where we are. There is a protocol that has been established. I can't tell you how much of that is actually being implemented, but it's a work in progress. Why are we wearing masks when it's being said that it's not right for the healthy to wear one? Again, growing evidence that suggests, well, one thing is all these articles are coming up that you can, the hypercapnia, which is breathing in your own air with concentrated of carbon dioxide, can be potentially lethal. Those are not necessarily been proven to be so. I use the example of doctors and surgeons who are in a surgery room for extended hours, 12, 14, 18-hour surgeries, and they are not necessarily bad. The issue of the mask is going to keep coming up. I think as we move along, it will become a new norm once you're in a public space or in public transportation, which is when you're at higher risk, mingling with people that you do not know. That's where I think it's going to go, not only specific for COVID-19, but with other viruses as we move along. What's the current advice to MOE on schools reopening? We can only provide advice. One of the key points in that is that we are suggesting that the school year may, or I believe that for the most part this school year is considered to have virtually been done away with. But if there is a new school year that's going to start, it probably will start earlier than the traditional September. That's our recommendation, at least, anticipating that we're going to have higher number of COVID-19 cases. And even if it's not COVID-19, traditionally we have flu cases, higher numbers towards the end of the year. So we are looking at perhaps, or suggesting to the schools that they perhaps open a much earlier in the school year, have a contingency plan for when they, and if they need to close sooner than the traditional middle of December calendar year. Is it okay for the Guatemalan diplomats coming from an infectious region to bypass the quarantine procedures believed have to rightly endure from a medical standpoint? Well, I think that you have a valid concern there, but understand that it's not only the diplomats that are being asked to quarantine home. We have a family from Benque, I think, coming in today. The gentleman has prostatic cancer. I think he's going to be allowed to quarantine home because he's not going to go to a quarantine facility. So we have in that 57 number that I gave you, people who are being asked to stay at home because they are cancer patients or they are undergoing radiotherapy, chemotherapy. So we are making provisions for that. I know that there's a family who leaves Belize either today or tomorrow. This is the third time that they have left and come back since we locked down, closed down the borders then, and that's because they have to go to radiotherapy. I know somebody's going to radiotherapy to Campeche. When they come back, they are quarantined at home. So, and it's not only the Guatemalan diplomats. We have had Asian diplomats who came in January, February from when they were having waves, and they were also quarantined at home. They were willing to provide all the necessary measures for us to screen them at home, swab them at home if needed. So that worked out well. And then this is the final question. It says, if a person needs to go to Merida for serious medical purposes, does that person and the attending assistant need to get written permission from the Ministry of Health and Director of Immigration? It's not a written permission. From Ministry of Health standpoint, if you're leaving the country, you might not necessarily need to get clearance from us. You might need to get clearance from Immigration, Foreign Affairs. Once you come back, then it starts to become a potential problem for us, and that's why we routinely get involved. What we routinely do recommend, though, is for people who are leaving the country that they inform the Ministry of Health, Immigration, and Foreign Affairs, and you are able to tell us what it is that you're going to do, where you are going, and when you intend to come back, so that we can prepare adequately for you. We do suggest that you send us the paperwork as to why you're actually leaving the country. And I'll give you an example. We got a note from somebody who wanted to go and get a cholecystectomy done in neighboring Melchor, but by the time you come back, you have to go into a mandatory quarantine because a cholecystectomy is something that can be done in Belize. Granted, it's going to be for free, if you will, but that's a procedure that can also be done in public facilities in Belize. And even if you pay it private, it's more than likely it's going to be cheaper than if you go across the border and have to come into a mandatory quarantine area. So in those instances, we try to to discourage people from going across the border for a situation like that. And we have found instances where people send us a medical report and we try to channel them to the adequate sources, because we also have people who just have a diagnosis who don't know where they're going to go. Who, for example, say, I'm going to Chetumal to get this, but Chetumal doesn't have that adequate. So we try to channel you to wherever you can get potential help. So that's why it's important, I think, that you inform us and inform the relevant ministries as to when you're going to be leaving and coming back. Particularly coming back so that we can prepare. Because if we don't have you in the list, then we'll have to find out where you live, go check out where your home is, and make the public health recommendations to safeguard your health and that of your immediate family that lives with you, for the setting in which you're coming. And also because understand that once you come back and you are home quarantined, public health officers will go and be doing routine checkup on the person that is quarantined. So the person who is ill and one other person can be allowed to come back and quarantine home, yes. That's also important that you ask, because some people want to take 3, 4, 5 family members, and then that becomes rather complicated to manage. So I think that's the last question. Esner, thanks for joining us. You are right, there's no specific activities for World Tobacco Day, at least no public activities, but we'll make a note in our social media outlets. It is this Sunday. What is the theme again?
The theme is protecting youth from industry manipulation and preventing them from tobacco and nicotine use.
And I'm glad to talk about youths, because it's not only tobacco. I mean, we're talking about electronic cigarettes and the vaping procedures, which is trending in some other places. And it's not only tobacco. Whatever people may smoke also has pulmonary implications. So I think we can't shy away from just the cigarette. So that's what we have for now. As I said, we're going to be coming back at least once a week to provide you an update. Understand that our job is to give you public health data based on evolving science. We are not going to be guided necessarily by our emotions and our opinions, which we are entitled to, but it's hard science, and we also don't necessarily legislate. We provide the advice and it's taken from there. Going back before we get to the mask issue, final notes: physical distancing, that is here to stay. That's one. Let's not forget to wash our hands. I don't know when is the last time we washed our hands. Don't touch your face, and masks have a proven benefit when you're in a public forum, when you're in public transportation. And as we move ahead, I think we need to start getting used to that notion of wearing a mask in public spaces primarily. Recommendations may come and go as we move along, but that's where we are now. So thank you very much.